I would like to welcome my co-speaker, Dr. Jayanta Kumar Das. So next he will be speaking on market survey planning and implementation. Doc
Okay, I'm sorry, Dr. Jayanta is running another
Instruction.
instruction course, so I hand over the mic to Jayanta.
Dr. Jayanta Kumar Das is an eminent ophthalmologist, and presently he is working as a senior consultant in HOD Oculoplasty in Retina Care Center. Besides being the alumni of Shankar Nethralaya, Chennai and Gangaram Hospital, he is also trained in Moorfields Eye Hospital. He also has been the HOD in neuro-ophthalmology and has worked as a senior consultant in oculoplasty in Sri Shankardeva Nethralaya. He is one of the few ophthalmologists in the country to have the PhD award, and is a recipient of 9 awards both nationally and internationally. So he will be talking on market survey planning and implementation.
So very important part is our the market survey and planning. So our all that to establish a setup to work even for a big institute. Market survey is the dark key for any success. So for the survey and planning, there is so many methodologies are there, but our the theme should be very fruitful to overcome all those. Basically, is a important type of tools to market related research. Apart from survey, other tools are interview, focus group and observation. One component is a survey, but you can engage few people for interview and few focus group. You can discuss with some focus group and your observation, your team person's observation is that four component of here. So, but our aim of the market survey should be pinpoint the customer's need. What is the need for the customers and analyze your performance. Target for continuous improvement for your performance. So, suppose we are doing, so this year that amount of operations, the amount of cataract patients turn up as a OPD, conversion rate in OPD, and your performance. Of course, the quality, without the quality is impossible, and another component is the cost. You can analyze the paying capacity of the patient of that particular locality, then only we can target it. If you are offering a IQ lens, if farmer, I think is no need. Farmer, yes, of course he need a FECO. He need a foldable. You can go for Indian foldable. That's the purpose, because he need a early recovery. But 90 years old, 80 years old person with a Brunosen cataract, no need for any FECO. You can go for SICS without any corneal edema. All those things. Equipments in mobile unit also very important. So you can engage your team with your fully equipped, even by a car, everything, slit lamp, laser, biometry. So blood sugar estimation, all can be done. Set a clear goal, clear view about your target. What you want actually, know what you want to explore. You want to service, so if there is a suffering from a more diabetic patients, and you can of course vitrectomy set up, and the ear surgeon is may not be eligible, so you can go for a laser at least. So those are the you can want to explore. Take help from experts, your previous surgeons, or your from others, or those are working for, or some media person or some known person who can help to consider the best way to get your goal. Do the survey effectively and the analysis. One is statistical analysis, another is the pinpoint target analysis. Uncover the wider implication. All. The types of the survey, again, it may be exploratory, descriptive and casual. Sometimes in a low cost we can go for a casual survey also. Or we can explore so many things, so many points, and that is descriptive type of. In exploratory, what we can do? Exploratory is an important component of any market related research. It is focused on the discovery of the ideas. It is suited as a beginning of your setup. So exploratory survey is for a beginner. Beginning, if you want to a setup in a new area, new location, or as a your first setup, you have to do a exploratory survey. Commonly used for our further defining issues of your setup, identify areas of potential growth, alternative course of action, prioritizing your need. So if already there is a two other hospitals, what are not available on that particular two? You can target all those to help. It is a type of kind of healthy competition. One, everyone knows that a survey monkey audience is at some theoretical point. All information may not be satisfactorily significant, but the take-home message for a monkey survey is some information can helpful to discover a new ideas or problems that should be addressed. Application of market survey, you can apply, only the survey will not help. You can test your hypothesis, wide those full or clear picture, widen your view to gain quantitative and qualitative sign, personalized survey, monitoring highest standard of good outcomes. So your outcome should be in a very much effective and patient should accept it. Otherwise, no, none of your survey, none of your effort will fruitful. So in a low cost, in a not, I am telling in a low cost is not a good form. It is in a logical cost, and then you are good as much as possible the service. Professional services also another important on that thing is expand your access to the customer, so your customer will be well served. This is our first motto from the survey. Good public relation for always superior than any type of advertisement. That is was well established on from all the earlier done surveys. Serve your customer in totality, not only if that on what his need, etc. You can take care all those things. Elevate your reputation pattern always. This is it will help lots. Potential friendly behavior deal and conduct competitive with strategic business opportunities. Even in the rural areas also we can avoid all those things, and that we can serve accordingly, and we can it will help our growth also. Our target should be invest your time and resources with maximize performance and professional growth. Program for building, nurturing and expanding your value of your setup. Utilize the opportunities to help you and your setup remain vibrant and relevant. Otherwise, it's not possible. What are the deciding factor from the surveys? What ultimately we can do? Look carefully the seniors and previous data, how they proceed or navigate their paths. Learn from their journey, and you can apply these lessons. Maybe failure or maybe a successful, whatever the journey, these lessons in your own career or setup, you can modulate. Thank you.
Thank you, Thank you, sir. That was quite